Australia's COVID-19 vaccination drive is set for an immediate boost. It will receive 500,000 doses from Singapore under a new swap deal. Australia says it will return the doses in December. Canberra is trying to accelerate its inoculation rollout as daily cases reach record levels.
A shot in the arm to Australia's vaccination efforts. It's set to receive 500,000 doses of the Pfizer jab in the coming days under a vaccine swap struck with Singapore. It's the boost officials have called for as they outline a national effort to speed up a sluggish rollout. They're hoping to fully vaccinate 80% of the population by the end of the year.
It's a dose swap deal, which simply means we're taking the 500,000 they have now, so we can put that into our distribution this month coming in September, and we will provide them with 500,000 in December. That means there are 500,000 doses extra that will happen in September that otherwise would have had to wait for several months from now, accelerating our vaccination program at this critical time as we work towards those 70% and 80% targets.
Meanwhile, the Delta variant continues its march. The capital city, Canberra, has extended a hard lockdown by 2 weeks. Victoria State is expected to follow suit. Before this latest outbreak, Australia managed to keep the coronavirus largely at bay. A system of strict lockdowns and quarantine did the work, but the Delta strain is putting all that to the test.
These patients are some of the sickest we've ever seen. They require so much support and monitoring and physical care. We're in layers of PPE, sometimes for hours at a time. The Delta variant is so contagious that we have entire family groups in our hospital. In some really tragic circumstances, we've had parents, both parents of young children, so sick that they need to be ventilated in our intensive care unit and separated from their children.
Australia is now banking on vaccinations for a way out of lockdowns, but there's still some way to go. Fewer than a third of its people are fully vaccinated. In Singapore, it's 80%. Vaccine swaps are not unprecedented. Israel and South Korea struck a similar agreement in July.
Roger Maynard joins us live from Sydney. Roger, the vaccine swap deal comes at a crucial juncture. Australia is still struggling to contain COVID-19.
Yeah, here in New South Wales, the government warns that it's likely to get much worse before it gets better. The Premier, Gladys Berejiklian, has forecast that October will probably be the worst month, with hospitals and intensive care units under increasing pressure. So a lot is riding on these extra Singapore vaccines to help reduce infections and hopefully put a cap on this deadly outbreak. And today's announcement is clearly a big boost for Australia's vaccination program, which the government hopes will inoculate 70 to 80% of the eligible population by the end of the year. The Prime Minister, Scott Morrison, has hailed the vaccine swap with Singapore as an example of international cooperation which will benefit both nations. So it's effectively a win-win situation for both, with Australia's Foreign Minister Marise Payne describing it as a constructive and flexible way for governments to work together in all our interests to manage COVID-19.
And Roger, despite the rising cases, the government is also preparing to shift its approach to COVID-19.
Certainly, attempts to eliminate the virus have largely failed in New South Wales and Victoria. And although other states have been fairly successful at keeping the Delta strain at bay, the fear is that it's only a matter of time before the virus spreads across the nation, and we have to learn to live with it. It's no secret that Australia has been in catch-up mode when it comes to the vaccination rollout. The government's come in for much criticism over not ordering enough doses of Pfizer last year. So it's desperately trying to obtain more supplies so it can treat younger Australians, in particular those between 16 and 29, and 12 to 15-year-olds who are due to start getting their jabs in mid-September. So far, about 58.7% of Australians have had their first vaccine dose of either AstraZeneca or Pfizer, and 35% have had 2 doses. But there's still some way to go before this nation hits 70%, and more importantly, the magic 80%, which should mean the end of lockdowns and the opening of state borders and the international border. Until then, millions of Australians will be subject to stay-at-home orders and all manner of local government restrictions to halt the spread of this deadly outbreak.
Yeah, thanks for getting us up to speed. Roger Maynard speaking to us from Sydney.